Hello everyone, I'm Dr. Chandan here. Today I'm going to share you the important topics in pharma which you have to make sure you revised well before you appear for your FMGE exam. Guys, these are the topics which are repeated in multiple exams and are expected to be asked in upcoming exam as well. So please make sure you don't miss any of these topics. And if you haven't started the pharma and you have very less time for your FMG exam, then I will suggest you to first solve the previous year questions and the topics which you see here with the multiple revision. So now let's see these topics which are very important. First is dose response curve. This question we need to know the graph. We need to able to identify in the graph itself that lesser the log dose, higher the potencies, and height defines the efficacy. Now next, clinical trials. Again, it's very important. You should know all the phases like preclinical and clinical, phase 1, phase 2, phase 3, phase 4. Next, organophosphate and carbamide poisoning. Again, organophosphate is extremely important. You need to know what are the side effects of because of this and what are the antidote you are going to give, like atropine. You need to know, and atropenization futures you need to know. And non-selective and selective alpha blockers. It's also very important, like we'll get to see some of the conditions like Chase reaction where we will give non-selective alpha blockers like phentolamine, phenoxybenzene, like that. And selective alpha blockers we have prazoxine, and where we will give this thing in case of BPH with hypertension. So just crystal clearly, just know those points which will be stressed by examiner multiple times in multiple exams. So no need to know each and every information about the topics. Next, about migraine. You need to know about migraine very well. The drugs will give for that, and whatever the clinical features of the migraine. And gout. Again, the gout is important. In gout, we need to know the uric acid, how you can able to mechanism drugs will be done. You need to know the drugs. Like we have the drugs that will inhibit the xanthine oxidase from the formation of this thing, and you need to know the drug that will excrete the uric acid outside. Like that, we have a different drugs. Gout is again extremely important. And next is anti-dyslipidemic drug. And we have loop diuretics and thiazides. In loop diuretics and thiazides, you need to know the loop diuretics act on which transporter and what are the drugs. And the same way in thiazides also. And next is hyperthyroidism and hypothyroidism, the drugs. What you will give in first trimester, second trimester, third trimester during pregnancies, as well as some other thyroid drugs also should know. And anti-diabetic drugs, like we have insulin secretagogues we have, and SGLT2 inhibitors and GLP alpha glucosidase. This is also very important. Just make sure you revise very well and with the notes you have. And next is again typical and anti-typical antipsychotics drugs are again typical, and atypical is very important because we'll again encounter this in case of psychiatry. So it's extremely important. Make sure you revise and solve the questions as much as possible. Next is opioid addiction. Opioid addiction, you need to know the features of opioid addiction very well. Then we have anticoagulants, like we have orally giving anticoagulants and injectably, and know very well about warfarin and heparin, and know about antiplatelet. Anticoagulant is again a very important. Next, growth factor. Guys, this is also very extremely important because in most of the paper we can see if they're asking about a growth factor, they're asking mainly of WBCs, like we have filgrastim, sargromostin, molgrastim, like that. Know about RBC and platelet also at the same time. Next, we have antiemetic drugs, like we have 5-HT3 blockers, like we know that, right? Like after the post-operative nausea and vomiting, we are going to give what? 5-HT3 blockers, like ondansetron, palansetron, granisetron. Those drugs know very well. Just revise the things frequently. You will get to know the name of the drugs very well. And know very well about domperidone, metoclopramide, also very important. And diarrheal drugs, for example, diarrhea is because of amoebiasis, diarrhea is because of bacterial infection, it may be because of carcinoid syndrome, VIPoma. In this condition, what are the drugs you will give? Know the treatment protocol also, it's very important. And next is about bronchial asthma drugs, like acute bronchial asthma patient and chronically or exacerbation may, what are the drugs you will give, like SABA, LAVA, steroids. The management you need to know very well. Next, about you should also make sure to know about these drugs also. It's very important. Like we have leprosy drug, like we have bedaquiline, also very important. which is ATP synthesis inhibitors, like we have, and we have like cisplatin, doxorubicin, methotrexate. These are all come under which drugs? These all come under the anti-cancer group of drugs. Now know about amiodarone, some of the cardiac drugs like ACE inhibitors, and drug in hypertension, whatever the drugs, like in case of pregnancy, what we will use, in case of emergency of hypertension, what we will use, in chronically what we will use, and know about selective estrogen receptor model like tamoxifen is also very important. Know that very well. So guys, this is the things you need to, these are the topics we need to make sure that you have been revised very well and you have solved a number of questions in these topics. Guys, pharma is actually not really a difficult subject. Just to make sure you summarize the important topics and keep giving multiple revision again and again along with solving the questions. This will really help you to boost your score. I hope this video will help you, and thank you and have a good day.